This is your patient's chart wherein you will look for your physician's order sheet. This is the page wherein your doctors usually write their order, whether it's a medication or a procedure that needs to be done for the patient. In the physician's order sheet, your order reads administer medication Cipifime or Cipifine 500 milligram IV every 12 hours to run for 30 minutes, reconstitute in 50 cc NSS. After that, you need to confirm it in your Cardex whether the right drug has been transcribed in your Cardex. So this is that part wherein you will look for the medication. So let us begin. What are the things that you need after verifying the doctor's order in the physician's order sheet and counter-checking it in the Cardex? You need to prepare the things that you need. Of course, you need your medication in powder form. It's Cipifime 1 gram. The stock available on hand is 1 gram per vial. Okay. And you have your syringe and your spare needle, and just in case it gets contaminated, you will have to change your needle. You need your plain assessed solution or your sterile water to dilute the powder form into liquid form. Okay? And then you need your swab, cotton swab with alcohol, or cotton balls soaked in alcohol to disinfect. You also need a medication tray. So right now we are in the nurse's station where medications are being prepared. Okay. Apart from that, you need a soluset. This is where we will dilute your reconstituted your diluted medication in the vial. So we will inject it later in this port. Okay, this part of the port of your soluset. Okay, and reconstituted in 50 cc NSS. So how did you know? Sometimes it is not written in the doctor's order to reconstitute it. You will have to do your drug study. Okay, so that you will know how much solution you need to reconstitute your medication. So your responsibility prior to preparation of your medication is to do your drug study. So you will have to follow our own format for drug study. You need to check the mechanism of action of your drug. You need to know what's the brand name. Okay, and you also have to check for adverse reaction. Okay, so that you will know what to watch out for or to evaluate as a response of your patient. Of course, then why was this medication given, or what are the indications of this medication, and your nursing responsibilities. Because this is through IV infusion, meaning to say you have responsibility. You have to make sure that these IV lines are free of air bubbles. Air bubbles they can be traveling air in the circulation of your patient, and thus can cause emboli or embolism. Okay? Okay. Let us now prepare the medication. You will need to calculate for the dose of the medication and then the rate of your drip infusion. So your desired dose is ordered with the doctor. You give how much? You give 500 milligram of your Cipifime, and then your stock actually, okay, as you can read, it's 1 gram Cipifime. Okay, 1 gram is 1,000 milligram. So that they have the same unit. So 500 milligram divided by your 1,000 milligram times 10 cc, no, according to your drug study, you will dilute the powdered form in liquid form. Okay, so begin with disinfecting, removing the lid, no, of your vial, and then disinfecting it with the cotton balls with alcohol or with alcohol in swab. Okay, discard it in the kidney basin, and then you will also have to disinfect, remove the covering of your NSS and disinfect it with alcohol. Then you will need your syringe. Okay, this is a single-use syringe and single-use NSS, no, meaning to say it's your patient's stock. So you will inject 10 cc of air in your vial and another 10 cc of air in your NSS. I'm actually using right now a 5 cc syringe. So if you have a 10 cc, okay, that is the preferred syringe. Alright, then you will have to aspirate 10 cc of NSS from the vial. Alright, you aspirate. Alright, you have another 5 cc, for example. Okay. So this is the proper way of. Then you use your scooping method. Okay. Scooping method in recapping. Alright. So you will now mix the powdered form. Okay, is mixed in the NSS. Okay, using the same syringe, we will now aspirate your desired dose, which is 5 cc. That means to say, since you diluted this, no, with 10 cc NSS, you will have remaining amount of 5 cc. So you will label this after that with the patient's name, the date and the time, no, this was diluted, and then the amount of solution used to dilute, no, the medication. So set aside, okay, and then you are ready to reconstitute this in a 10 cc soluset, 50 cc, I'm sorry, soluset. So scooping again. Alright, so that's it. So set aside your medication. Now we will calculate for your flow rate or the drops per minute, no, how much, no, you will regulate, no, this intravenous line. No, so your flow rate formula is total volume that will be getting the cc per hour. Okay, that's the amount of solution inside your soluset. So this is 50 cc. Okay, to run for 30 minutes. So you have to, well, 30 minutes is about 0.5 hours. All right. So we have to multiply this with the drop factor. So your drop factor, since it's a micro drip, this is a needle, okay, in this chamber. So 60, the drop factor is 60, okay, drops per ml. All right. So we will infuse here by opening this regulator, okay, and filling this up with your NSS solution until it reaches 50. So you may kink and fill this chamber with 50 cc water. So after it has been filled with 50 cc NSS, you will close it up here. Okay, your NSS is okay, as shown is here. All right. So you will have to prime your tubing, fill in with your NSS. No, make sure that there is no air. Okay, we are ready now to inject the 5 cc cepifim, okay, in the soluset port. So we have to disinfect first this port, okay, and then you will inject your medication. Make sure that the regulators are closed and are not running. Okay. Alright. And then make sure that there are no air inside your IV lines. Okay. And the end part of this this soluset, okay, this one, end part of which you will inject it to the port of this main line. Okay, so assuming that this is the main line, we already by using a needle, we will inject it in this part. So again, you will disinfect first this port. Okay, you connect your soluset. Okay, after that, you will open the regulator. Okay, and calculate the drops per minute, meaning to say in 1 minute there should be 100 drops per minute in the needle. So that's 1, 2, 3 up to 60 drops in 1 minute. Right? So using the second hand of your watch, okay, you will regulate the rate of this drip infusion. So in 30 minutes, okay, this medication will be completely administered to the patient at 100 drops per minute. Okay. Also, do not forget to evaluate the patient's response after the medication has been given. Any signs of side effect, adverse reaction, if there are any rashes, for cepifim, you have to watch out for rashes, abdominal pain, nausea and vomiting, many others. Alright, so if the patient has complained, you need to evaluate that. So that will be your patient's response to medication, most likely. Okay, so after care should be done after this medication, so you have to be there, okay, before 30 minutes, and you will close the regulator, remove your soluset. Okay, after giving the medication, okay, you must observe timely documentation. So you need to sign the medication in your patient's chart in the medication treatment sheet. So this is the form we are using, okay, in the hospital, in our base hospital. Okay, to show you, the medication sheet after it has been transcribed with the patient's name, the room number, and then the doctor of the patient, your medication, okay, and third, okay, here we have cefepime 500 milligram IV every 12 hours. The date to day it was administered. So it was given 8 a.m. in the morning. Slash it off, and then your initial signature. And of course, you will have to log your full name here with your initial signature. So that ends Okay, our demonstration for medication preparation and your administration of your medication via your drip infusion. Thank you to one and all. Okay, for the aftercare, no, you need to discard your sharp, your needle, okay, in a sharp container. And of course, do not forget to do your hand washing after the procedure.